Right, so let's see a few things which are must. When you're appearing for PLAB2 or any kind of OSCE exam, these are very must things that you definitely have to keep in your mind and keep in consideration. Right, first read the question carefully. So you will be having a question like in PLAB2, you know that question will be divided into 5 headings. So make sure you read the question carefully, which department you are in, what is your job. Your job is to take history, your job is to do examination, your job is to do the counseling. Do you have consent from the patient or not? Do you know the presenting complaint? Everything. I mean, the question is very important. So read the task carefully. Please do not miss any point from the task, otherwise it might be very difficult for us. So read the question carefully, very important. Second, do not interrupt the patient. You know, what you'll see in PLAB2, some patient, maybe like angry patient or demanding patient, they are talking too much, continuously they are talking. And there what you need to do, you are supposed not to interrupt the patient. You might be thinking time is running. Don't worry. When they are talking too much, actually listen to them carefully, because they are giving you some very important information, and make sure you are getting that information and retain that information, because if they have given you some information and then you're asking that information again and again, patient might not be that much comfortable in talking to you further, right? And please do not interrupt them. Even if they are talking for 1 minute, 2 minutes, 3 minutes, let them talk. Do not interrupt them. That's very important. Communication is the key. You know, in PLAB2 or any of the OSCE exam, communication is the key. How you are communicating with the patient, how you're communicating not only with your words, with your full face, with your other non-verbal gestures as well. If you're smiling, how's your hand gesture, how's your sitting posture, all these things are really important, right? And communication, you have to be very empathetic. You have to give them full importance. Only then you will be having a good rapport, and your patient will feel much comfortable while talking to you. So communication is the key, right? Acknowledge the emotions of the patient. You know, there are some non-verbal cues as well, and you need to acknowledge those things. For example, patient is angry. You are not supposed to say, oh, please calm down. No, that's very wrong thing if you will say. If you say calm down, patient will be more angry. What you're supposed to do, you need to acknowledge the emotion. I can see you are angry. I can see you are upset. I can see you are frustrated. I can see you are embarrassed. I can see you are anxious. I can see you are concerned. I can see you are not happy with the treatment. So you need to acknowledge what kind of emotions you see. You need to say that in your words. What you see, you have to say. Right, so acknowledge the emotions of the patient. That's very important. Please do not miss. And if you have to say the same line few times in a scenario, do not hesitate to do that. Please acknowledge the emotions of the patient. That is very important. I would say the most important thing in PLAB2 or any of the OSCE exam is to acknowledge the emotions, because if they're angry, that's a finding, and if you don't acknowledge it, how they will get to know that you got this finding, and they will be angry throughout the station. But if you say, I can see you are angry, upset, then you will see slowly they'll calm down automatically, right? So that's how it goes. Be honest and be yourself. That's very important. Be very honest, right? For example, like they have asked you a question and you're not sure about the answer. What you're supposed to do? Say, I don't know. You are a junior doctor, and if you don't know any answer, that's absolutely fine, absolutely okay. You're not supposed to know every single thing. You're not the multi-specialist of every particular field, and you're just a junior doctor. So what you need to do? I'm sorry, I'm not sure. I'll get back to you. I'll just confirm with my senior. I'll get back to you. That's absolutely fine. And be yourself. You know what we have seen, like lots of candidates try to imitate someone else. They might have seen some YouTube videos or something else, like and they try to imitate maybe their friends whom they are practicing with. Do not try to imitate anyone. Don't try to be someone else. What they want to see you, and be yourself in the exam. Definitely need to practice to show some empathy, some like importance to the patient you have to give. All these things you have to do, but don't try to copy someone. If you try to copy someone, you will lose you will lose yourself. That we don't want actually. So be very careful, be honest, and be yourself. Open and close question. You know, it's very important how you're putting open and close question. Try to put always open questions. That would be really important. If you put open questions, you will see patient is giving more and more information, and you will see you will save a lot of time, because in these kind of exams, you will see time is very crucial. You won't be having too much of time, you will be having a limited amount of time that you have to utilize properly. So ask open questions, like for example, patient is in pain, doctor, I'm in pain. Don't ask where is the pain, what kind of pain it is. Ask very open question, tell me more about your pain. So, it's very important when you ask, tell me more about your pain. Patient can tell you everything. Patient can tell you the site, the onset, the radiation, the character, exacerbating or relieving factor, scoring, everything patient can tell you. But do not ask close questions straight away. Don't ask close questions straight away, right? So that's how we have to put for open and close questions. Now, what's this comfortable to talk and painkillers? When you start the question and patient is saying, I'm in pain. You started the station, how can I help you? Patient said, I am in pain. So how you need to proceed for the station? First of all, you need to ask, are you comfortable to talk? You need to ask, are you comfortable to talk or not? And mostly patient will say, yes, I'm comfortable to talk, right? And then you can proceed with the station, right? If patient says, I'm not comfortable, then you need to say about the painkillers. Would you like to have some painkillers? Would you like to have some painkillers? So if patient says, yes, doctor, if you can. So if that's the case, you can give painkillers to the patient. But how and from where the painkillers will come? So simply have to say, now you have to take the help of the examiner. Examiner, my patient is in severe pain. I would like to give painkillers to my patient after making sure there is no allergy and contraindications. So that's how you will offer the painkillers. So what you need to do when patient is saying, I'm in pain, ask the patient, are you comfortable to talk? Mostly patient will say, yes, doctor, I'm comfortable to talk. Then just proceed. How can I help you? And patient will say, and patient will elaborate about the pain. Tell me more about pain. You just go and elaborate the pain. But if patient says, no, doctor, I'm not comfortable, then you will offer painkillers. Would you like to have some painkillers? Yes, doctor. And then you will give painkillers, right? One very important point. Suppose this is an examination station. For example, this is an examination station. Do you think you can give painkiller in the beginning? You might not be able to give. You know why? Because if you offer painkillers in the beginning of the station, you will not be able to do the examination. Or even if you do the examination, you will not be getting the finding, because before you do the examination, you have already given the painkillers and you have already masked the finding, which is pain. So you have to be very, very careful. So see what kind of scenario you are dealing with. If you know that I'm going to do the examination, so tell the patient, I will give you painkillers, but let me examine you first. Let me do the assessment first, then I'll give you painkillers. I mean, promise with the patient that I'll give you painkillers, but let me examine you first. Right, but if the case says, if you know that you're not going to do the examination, or my painkillers is not going to affect my examination anyway, so you can offer painkillers in the beginning. Otherwise, be very, very careful while you offer painkillers. Right, so in the beginning of the station, make sure whatever the patient complain, like it is cough, it's shortness of breath or pain, ask, are you comfortable to talk? Are you comfortable to talk? That's very, 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 very important. So all these things are must. These are must things that you need to do in the exam. Make sure. Right, and what we are supposed to do, we have to maintain two-way conversation. In PLAB2, maintain two-way conversation. When you are doing history taking, what happens? In history taking, yes, you are trying to maintain two-way conversation. You're asking question, patient is answering. So it is a two-way conversation. But later on, when it comes to the management, sometimes what happens, candidates think like, okay, I'm running short of time, and they just go very fast in the management. Don't do that. Take your patient with you, maintain two-way conversation. If you're not able to maintain two-way conversation, you're not going to get any mark, right? You have to have patient with yourself in the conversation. Examiner, they want to hear two voices, your voice and your patient's voice. In the history, yes, first few minutes, he's able to hear both the voice, but later on when you are doing the management, he's not able to hear the voice of your patient. Why? Because you are the one who is talking. That should not happen. So what you're supposed to do, after saying few lines in the management, after saying 1-2 lines, make sure you take a pause. You take a pause. That is very, very important. So once you take the pause, what will happen? So patient will try to ask you some question, right? And that is what you're supposed to do. You need to give time to the patient so that patient can ask a question. That's very, 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 very important thing, right? One of our colleagues used to say, like, after saying few lines, you need to swallow your saliva. Right, so if you swallow your saliva, what happens, actually you are giving some time to the patient to talk. Right, or I would say, like, after saying 2 lines, Take a deep breath, meaning you are giving time to the patient to talk. Very important, maintain two-way conversation. And if patient is not talking, patient is on silent mode, you can use some lines so that patient will talk. How does that sound? Are you with me? Are we still together? Are you getting me? Are you keeping up with me? Are we still on the same page? So maybe you can use these things. That's really, really important. That's very wonderful actually. You can use these things. For example, like patient is keeping silent. You have given the pause, patient is not talking at all. So you can ask, John, are you getting me? Oh yeah, doctor, I'm following you. So meaning what happened? Patient started talking. So once patient started talking, that's absolutely good. You need to have your patient with you. That's the aim in PLAB2. That's the aim in any OSCE exam. Maintain two-way conversation, right? That's very, 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 very important. What else we are supposed to do? We have to keep patient involved in the conversation. That's very, very important. Let the patient ask question. Make sure you are giving enough time to the patient to ask question. Because see, when patient comes to you, why the patient come? Because patient has got some problem, patient has got some queries. And if you're not giving enough time to the patient to ask question, you will end up the station. Patient is still having those queries, those questions in his mind. Do you think the conversation or the consultation was helpful or of any relevance? No, not at all, because patient came with some question and now still he's having those questions, so it's of no use. So make sure you let the patient ask questions. Pick verbal and non-verbal cues properly. Pick verbal and non-verbal cues properly. That's very, 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 very important, right? Verbal cues, it's easy to pick. Non-verbal cues, sometimes like patient is not looking at you, not giving eye contact, patient is shaking his or her leg. So these are some non-verbal cues you might get in the exam. Please pick up those, right? Go slow, don't rush. I know sometimes you'll feel I'm running short of time, I have a lot of things to cover. Do not rush the patient. You know you have got 8 minutes in PLAB2. Even your patient, your simulator, your examiner, they also know you have got 8 minutes. If you're doing well, they'll help you. They are there to help you, but you should know how to take their help, right? Do not rush the patient. Give them importance. You will definitely get it back from them. That's really important. So go slow, don't rush. Don't answer if you're not sure. You know what happens? Sometimes they have asked you a question, you try to answer. That's not a bad habit, but sometimes you will see you have given a wrong answer, and that is going to affect you very badly, because what they want, they simply want a safe doctor. So if you have given a wrong answer, that makes you unsafe doctor. So you have to be very careful that you are not making yourself a unsafe doctor. So if you're not sure about any answer, be very honest. I'm not sure. I'll consult with my senior and I'll get back to you. So don't give any wrong answer. If you're not sure, don't answer. That's the best thing that you can do, right? So these are the things you definitely have to do. Thank you.